delirium tremens. Delirium tremens, or as it's often called, alcoholic psychosis. This condition, again, is typical of a professional alcoholic, a person who has already been dealing with this problem for a long time. This psychosis is accompanied by hallucinations, fragmented delusions, fear, and motor agitation, all while the person remains conscious of themselves. When a patient is admitted to our clinic after a prolonged drinking binge, we consider the possibility of alcoholic psychosis or delirium tremens, because it develops at the moment when a long period of heavy drinking is suddenly interrupted. Throughout the day, the person experiences mood swings, which generally become more pronounced in the evening. He begins to see certain hallucinations, such as small animals or insects. These are manifestations of visual hallucinations. But sometimes auditory, tactile, and temperature hallucinations also occur. However, when a person is experiencing withdrawal syndrome, their mood is generally monotonous and unchanging. Delusions also develop, usually delusions of persecution. They are disoriented in their surroundings. While in the hospital, he says that he's at home or at a movie theater watching some film. This condition is also characterized by lucid intervals, when during the day all the hallucinatory and delusional symptoms subside, and in principle the person is able to perform professional duties. By evening, however, everything worsens again. It usually occurs on the third, fourth, or up to the seventh day. If it manifests with severe somatic symptoms, changes in blood tests, and autonomic somatic disturbances, this can even lead to a fatal outcome. For a more professional differentiation, alcoholic psychoses are classified as professional, mattering, reduced, and atypical. This is only for easier classification, to understand the complexity of this psychosis and to develop a treatment strategy. The way out of alcoholic psychosis can be a prolonged medicated sleep that is a lethargic state, or it can be fragmented, with the consequences of developing encephalopathy. Encephalopathy is a condition manifested by neurological, psychiatric, and somatic disorders accompanied by degenerative changes in the brain. In other words, this is already a complication after psychosis, which also has its own classification and treatment. That is, in this case, intoxication has dealt a significant blow to the brain. This is when patients have already developed a new nosological form, manifested as neurological, psychiatric, and somatic symptoms. Treating encephalopathy is very difficult. Encephalopathy also has its own stages and degrees, and later on the patient continues to be treated in the neurology department. Treatment of such patients in the hospital is, let's say, not easy. First and foremost, as I mentioned earlier, it requires skill and expertise. There is a specific algorithm for treating alcoholic psychosis. First of all, it involves care, observation, a protective regimen, and a specific group of medications that allow us, within a certain period of time, to bring the patient out of this state and restore normal verbal contact. This happens when their hallucinations subside, when they return from the illusory world to the real one. And then direct correction of their psychosomatic status takes place along with psychosocial rehabilitation. If this condition arises at home, I simply recommend not trying to manage it on your own, but instead involving qualified specialists and transferring the patient to a hospital. Because this condition, I repeat, requires a protective environment and specialized skills in order to bring the patient out of it and return them to life.